And we're live in 3, 2, 1. Okay. Hello, everybody. Welcome to our next episode of Deliberation Academy, where we have my brother, Marcus Carreon, who's going to be talking to us about COVID-19 because he's an epidemiologist working on everything right now. So hello, Marcus.
Hi, everyone.
Howdy, Marcus.
So Marcus, can you tell us a little bit about what you think is going on? Just, quick thoughts before we start diving into specific questions.
Yeah, so I personally think maybe some people think coronavirus is kind of over, kind of attitude responses in terms of making sure you're staying at home as much as possible instead of going out. I see a large influx of people going back out into the world and, you're getting on those freeways and they're crowded again and it's you an hour to get where you're going. Back in February when we were on lockdown, taking about 20 minutes to get to the location, and now it's taking about an hour. I'm here to tell you that coronavirus is still very real. It's still very happening, and we need to take it seriously. People are being infected every day, even though it does appear that the numbers are reducing, that people are still dying and people are being infected, going to the hospital every day.
Right. So I guess one of the big things that's kind of on everyone's mind at the moment is, in the news, we've seen a few things about new strains of the virus or new mutations of the virus. And also I've personally have seen some articles talking about people being able to be reinfected. So could you explain a little bit about, maybe first just, how many new strains are there if there are, multiple, and then maybe, what do we know about potential infection?
So I'll go ahead and talk about the strains. I'm not sure how many strains are actually out there. I do know that there are definitely multiple strains. And depending on the immune response or the side effects that someone is experiencing or the symptoms that someone is experiencing, it's kind of, people are saying it's linked to the strain that they do get. So they're saying that some strains cause a harsher reaction, others don't. So that's something that we are seeing and we're investigating, and that's all going to take time. In terms of reinfection, first I'm going to start off with a political answer. The political answer would be something along the lines of short-term reinfection is not possible, right? And how do we define short-term? That's a very subjective term. Is it a month? Is it a week? Is it 2 days? Is it a year? If the coronavirus functions like the flu, there's a seasonal yearly mutation. Could it mutate sooner, right? Where someone is now susceptible every 3 months and they can be reinfected? Or is it on a yearly basis, bi-yearly basis, or even further? Time will tell. I know that there's some situations where we are seeing people being reinfected in various parts of the world. So it is possible. It's definitely possible. I personally think that those people that reinfection is happening, you have to further investigate what's going on there. What was the immune response the first time versus the second time? Let's do a serology test. Let's run for different mechanisms and see what the immune response was the first time. So there's a lot of things that you can do with that, and I would personally like for the people who did get reinfected, I'm sure there's going to be research studies, volunteer your time, volunteer your services, so we can kind of research you.
Right. So on that note, I also have read an article talking about potential brain damage from COVID-19. And there's other diseases that have caused some sort of a brain damage. Could you explain a little bit about that?
Yeah, so I actually haven't heard about the brain damage. There's a lot of side effects, right, of getting a virus, of getting any type of illness. And I'm sure that it's a possible long-term side effect that we're going to see. And maybe it could be like a confounding effect, or maybe it's really not caused from COVID and this person had other comorbidities that caused it. Or is it really caused by COVID? We need to, research that and find out, and time will tell. Is it like a one-shot scenario where this happened to one person, or did it happen multiple times over and over again? Are there different factors that are linked to these people that cause them to have brain damage? You know, that's all questions that can be researched, but they do require time to do that.
Right. So in general, what do we know about the long-term effects of people who have recovered from COVID-19?
I think we're using long-term subjectively here. So coronavirus is novel. It's been around since late December here in the United States, probably, you know, let's go with a political answer of February. So the long-term side effects are still unknown. You know, we're still dealing with short-term side effects. We're still within the first year of this virus.
Right. Are there any known short-term side effects, you know, within
definitely.
weeks or months?
I cannot think of any right now off the top of my head. I'm sure that there are some, whether it's someone, you know, winding up in the hospital and they're put on life support or various consequences to that. I'm sure we're going to see like different various lung issues. And, you know, some people are having amputations because of their response to this virus. So those are all, I mean, like an amputation is a long-term side effect, right? Or a long-term complication. So that's one thing that we are seeing.
Okay. Lucas, do you have anything?
So as far as like asymptomatic people, I saw an article where it was saying that like around 40% of the population is, you know, or people who contract COVID are around asymptomatic, meaning that they don't show any signs or symptoms.
Yeah.
What are your thoughts, or like what are the numbers that you've come across?
You know, like asymptomatic spread is definitely concerning, and I've heard that it's as high as 40% as well. Um, if it is as high as 40%, that's really concerning, right? Because now most of our public health screening processes are based off of symptomatic. So that means you're with some type of symptoms. You know, right now you're going to the grocery store. If you want, you're going to a restaurant. What are they doing before you go inside? They're screening you. Maybe not at the grocery store, they're screening, but definitely at restaurants, you know, they're taking your temperature, they're monitoring you for symptoms. If you want to go back to school, it's going to be a similar process. So those are all symptom-based screenings. When we're talking about asymptomatic, you have no symptoms. So you wouldn't be identified in those situations. So if that's happening 40% of the time, that's not.
That means that you're nobody's really safe if you're going to restaurants or something.
Yeah,
like that.
we might as well
Suggesting.
just at 40%, we might as well just say 50%. You know, it's like flipping a coin at that point.
Wow, it's a little alarming. I guess going back onto the potential for reinfection, what does that mean for herd immunity? How does that affect us going into?
Yeah, so, you know, that's a very hard and complicated answer to make. So for those of you who don't know, herd immunity is basically when you get to a certain percent of the population is infected or immune because of vaccine, you are now protecting the other proportion of people from getting infected. So herd immunity with coronavirus is predicted to be anywhere between 60% to 70%. So that means upwards of 70% of the population would acquire immunity either through a vaccine that we're currently working on that's going to take some time to get out, probably another year to get there, or the individuals that have acquired infection. They should have certain antibodies. Now, we're also running into the issue for people that get infected. You know, we're seeing a reduction in antibodies like after 3 months. Are their antibodies still high enough to protect them? So that's like, you know, when reinfection does come into question again, what level of antibodies do you really need or have to have? And again, these studies to really prove like take time. And so with that, if this virus functions closer to a seasonal mutation, or it is mutating where someone can get reinfected, let's say within the same year, or even within the same 2 years, it's going to be significantly harder to reach any type of herd immunity because now we're dealing with multiple strains. They're being infected with multiple strains. At that point, like, is herd immunity even possible raises a question. Like, we can turn towards the flu. We have a seasonal mutation of the flu. Do we get to herd immunity threshold every time with the flu? Every year? Probably not. It's seasonal, it dies out, and, you know, we have vaccines that stop the chains of transmission with that. So it's definitely concerning, and it's something that needs to be discussed on a very high level, and a lot of research has to go into it. And I think next year, when, you know, like, COVID's not going to be gone within the next 365 days. So 365 days from now, we would have a better understanding of reinfection. and what that looks like for the next coming year.
365 days from now, you're expecting COVID to still be here.
Yeah,
so
I mean, like,
real quick,
yeah.
I just wanted to double back. So we were talking about a 40% of asymptomatic cases, somewhere around there, right?
Right.
So on the one hand, it seems like, that is alarming, because you can have so many more people walking around carrying the disease without even knowing it. But what on the other side, does that also mean that there's 40% of people who are infected are not at risk of like death or severe ailment if they're asymptomatic?
I guess you can say that. I'm afraid I don't want to make that assumption. I can see how that's like an assumption that can be made. Time would tell with that. I'm not committing a yes to that answer at this moment. But I think we also have to look into, yes, 40% of people have asymptomatic, right? But how transmissible are they? Do all 40% of people still pass on the virus to someone else? Or is it when they're asymptomatic, that 40%, let's say 5% or 10% is passing along that virus? So that's something that, has to be further explored and investigated. Is that 40% really every person contributing to one or more cases? Probably, we got to see how infectious they are.
Right. So the real risk of the asymptomatic cases is the transmission.
Of course, yeah.
Right. Thank you.
So within public health and within public health measures, like when we're doing the stay-at-home orders or the quarantine or the isolation, it's all to stop the modes of transmission. It's all to prevent the next case from arising. That's how our numbers are reduced. That's how we can control the pandemic, really. And so, yeah.
Thanks.
Gotcha.
On that note, I have another question that some people raised the last time we interviewed you, which I hadn't considered, which is we talked about contact tracing, and we kind of went briefly over how contact tracing works. And maybe in a second here, maybe just give us a brief refresher just for anybody who doesn't remember or doesn't know how contact tracing works. And then the question is, that was raised was, isn't this government overreach? Because somebody expressed to me that they are completely against contact tracing and that the government has no business, monitoring people this way. My opinion is that it's a public health measure, and it's, something that's being used to try and, manage this problem that we're having. Could you maybe, like I said, explain a little bit about what contact tracing is and why this is not, this is supposed to be protecting the health of the people. Is that
of course, correct? Yeah. So basically, contact tracing is identifying a case, right? So you identify that case, you do an interview to identify their known contacts during their infectious period. Once you identify those contacts, we are calling them, asking them to isolate for 14 days. So the incubation period for the virus is 14 days. So they'd have to quarantine 14 days from their last date of exposure. That process, I don't know if you want me to speak more on that process or if you want me to speak more on like the benefits of contact tracing, because if we didn't have contact tracing in place and it's like, okay, I'm not in favor of contact tracing because I'm in favor of my own rights as a citizen. Like I get that and I sympathize towards it. But at the same time, if we didn't do contact tracing, didn't identify any type of, like if we weren't working to stop the modes of transmission, you can argue that the economy is going to get worse. You can argue that the environment's going to get worse and complete anarchy is going to uprise. And like, it's just going to be a worse case scenario. And, who's to say what that would look like and what that would go into.
Right.
In terms of violating someone's rights, when the government calls, I understand that it's concerning, it's alarming. There's plenty of scams going out there where they're pretending to be your local health department or they're pretending to be the CDC and they're trying to obtain your sensitive information. And so I do sympathize for situations like that. But at the same time, if you're being called and you're notified like, hey, you were exposed by John Doe on August 8th and you need to quarantine until this date, this is the health officer order, you really do need to comply, because if you're not complying, you're adding to the modes of transmission, and you're making our environment and our jobs a lot harder. And you're preventing kids from going back to school, you're preventing the workforce, you're slowing down the economy, you're making it worse. You're the negative in the situation instead of the positive, and we're moving in the wrong direction by that mindset.
Right. On a similar note, it has also been brought to my attention that we've been working, I think several entities have been working on some sort of vaccine with some amount of success. I'm not exactly certain, but they've been working on it. I think we can all agree that entities have been working on a vaccine.
Yeah.
And one of the things that's going on, at least in our nation currently, is a large anti-vaccine movement. I guess largely founded, when I remember when I was a lot younger, this thing went around saying that vaccines cause autism. And the guy who did the study lied a lot and falsified so much stuff to put that out. And I think in the end, they actually stripped him of a bunch of things and kind of cast out that data because he lied. But regardless, today, regardless of what actually happened, today there's a large movement of people who are very against vaccinations. I know people in my personal life who are against vaccinations because of trace amounts of chemicals that are present in the vaccines. And so one of the things that people have thought is that, I think it's called hydroxychloroquine.
Yeah, hydroxychloroquine.
Is an alternative, a non-vaccination treatment of COVID-19. So could you maybe explain, if any, there are, what effects could that have on treating COVID-19? What even is it? What is it for? And would it actually make any sense to use it with this disease?
Yeah, so I'm going to start off with a professor. He was a research professor that basically said vaccines cause autism. And, it was preliminary research, preliminary data that at that moment was showing it. And because he didn't have enough power to actually prove the truth. And so he kind of jumped the gun and published something before he should have. He's recanted multiple times. And so, it just hasn't made its movement to around the world saying like, hey, my research was actually false. And as a scientist, you believe something until it's proven wrong. And so that's what we're having. And, a lot of people have trouble with change and trouble with difference in beliefs. And so, they have this research study and they just ran with it. So that's kind of what happened. In terms of concerns with anti-vaxxers, it's a major concern, right? Because once we have a vaccine developed, once we have a vaccine developed and you have people naturally infected, we still have to get to that herd immunity threshold, right? So right now, I think we're somewhere around probably 4% in the United States that have been infected. I haven't looked at the numbers recently, but let's give or take a percent or two. And so we're somewhere around that range, right? That's a long way from 70%. So that means we probably need to vaccinate at least 50% of the population. A lot of people are going to have issues with vaccinating themselves and their children for a multitude of different beliefs, right? And that's a challenge that multiple public health departments are going to face across the United States. And we also have to talk about the finances of it. Who pays for it? Are we relying on individual healthcare plans to pay for it? Loads of Americans were just placed on unemployment. They lost their healthcare benefits. Are they expected to pay for it out of pocket? And then we have to talk about all the other Americans that never had health insurance to begin with. So that's another, we have issues when it comes to that. That's why I say this is far from being over. We are just in the beginning. In terms of hydroxychloroquine, there was a study done here in the United States. I can't remember the institution that did the study, but basically we have something called a non-inferiority trial. And it's put hydroxychloroquine against a placebo. And, you randomly select, I'm giving this patient a placebo, or you randomly give a patient hydroxychloroquine. This study showed there's no difference between hydroxychloroquine and the placebo. So it had no benefit. There's no difference in your outcome. So even though, let's say I gave 300 people hydroxychloroquine, they all lived, maybe they're all hospitalized, minor symptoms, whatever, they all got better. Just because I did that doesn't mean to say that it was the medication that did it, that it worked. Maybe they just got better on their own. Or you also have to consider the placebo effect. Maybe they're told this is some magical pill, and that's what happened. They just got better because of the placebo effect. So there's loads of issues and loads of ways to discuss it.
Do you know what it was actually developed for? What the drug was developed for?
Hydroxychloroquine, you know, I don't want to say because I don't remember off the top of my head and I don't want to ponder right now.
Right, no worries.
If you pull it up or real quick, then I can comment on it.
Yeah, malaria.
Yeah, for malaria.
Treats malaria.
And I think it also should benefit for treating SARS, I believe, but I'm not 100% sure.
Okay. So going back to, you said that you're expecting that this virus is going to at least be here for 1 full year. How would we, what should we do in terms of the economy or like being able to open up? Is there something that like a way to be able to stimulate the economy at the same time as this virus, or is it pretty much everybody have to stay at home for that full year? You know, it's a very complicated issue, I understand, but.
Yeah, it's very complicated. I'm not an economist, but I can definitely weigh in. We have our public health measures, and you know, there's essential staff that's still out there working, moving our economy, and there's loads of people that are still able to work from home. We're really pushing for the employers that had their employees work from home for 2 to 3 months that were successful, that have now returned back to work. They shouldn't really be back on the work site. If they can remain working from home, you know, that's a major win because they're not exposing their coworkers, they're not exposing by going to multiple areas, and that's a win for us. You know, there's a lot of outbreaks right now within workplace settings, and it's concerning. And there's been multiple large factories and workplaces that have been shut down. Who's to say as well as what factories, what industries are compliant with your district guidelines? You know, that we've come into multiple situations where individual companies aren't compliant, and we find out through a third-party person reporting this. Employees want to feel safe at work and they want to be safe, and there's certain public health measures that can protect them and keep them safe, and others, when they're non-compliant, the outcomes can be very unfortunate. In terms of opening up the economy, I personally think within the next year, life is not going to be what it was in 2019. You know, it's not going to be the same, where it's just not going to be the same. And so as humans, we're very adaptive creatures, and we need to learn to adapt to the situation. If we want life to return to normal in a decent time frame, I think we would have to follow the public health measures the best possible, you know, because if our infectiousness or like our counts and our incidences go up so high where it's unmanageable, our hospital systems will collapse. Our public health systems are going to be so overwhelmed. When that happens, the only solution would be to do a major lockdown, you know, and no one really wants that anymore. So it's understanding what you're able to do safely, and to compromise on both levels. From a public health standpoint, we have to compromise and allow people to go out and do fun activities. You know, everyone wants to go to the beach, they want to do something, but to do it safely is like the number one concern.
Correct. And a lot of people don't want to wear masks, and we're breaking down into political tribes and stuff like that. You know, and so it's further complicating the issue. I guess to build off of, you know, how we ought to control the virus, I noticed that there's been some type of confusion between the federal, state, city, and county levels. Is that something that, you know, that you could touch on a little bit?
Yeah, I can definitely touch on it. So, you know, the highest level of government that most of us are taught in school is on the federal level. After the federal level, it comes the state level. After the state level, it comes the county level, and then it becomes the city level. And when you're following your guidance, more than often, it's going to be on the county level. So yes, look to your state guidance. Yes, look to the federal guidance. But in order to be compliant with the area you live in, you need to follow the county's laws and guidelines and policies. The county can be, at each level, they can be more restrictive. So the federal level kind of sets it, and then the state level can be more reserved, and then the county level and cities can be even more reserved than that. In terms of your health departments, they're all on county levels pretty much. I mean, you have state departments and federal departments, but the ones that you need to listen to and you're working with and communicating with are all in your county levels. Our laws are, our policies, our guidelines are made to be in compliant with the federal and state level. Sometimes we are a little bit more restrictive, just, every county is different. You're going to wind up in some that probably still have minimal amounts of cases, others that are upwards of over 200,000. So it all depends what district you live in. If you're in a rural or urban place, guidelines, policies change, and they can be more restrictive or less, or on the same par with the state or federal government. So, yeah.
Correct. So in terms of like, we're seeing a little bit of backlash between like the federal level and the state and the county. And what I guess I mean by that is we're seeing certain people saying that the federal level did not act, well enough for this, but at the same time, the states were opening up the economies as well. So I feel like there's a lot of miscommunication even at the state, city, local level in terms of that.
Well, I mean, like, it's challenging, right? Because we want to compare state to state, but can you compare like Florida, Texas to North Dakota or South Dakota? They're just completely different environments. Can you compare the rural states to metropolitan areas? It's challenging, and the guidelines and policies you're going to make in each of those situations are challenging. So when we look to the federal government to make guidelines, are those guidelines really fair across the different types of areas that we have here in the United States? I commend our governors, I commend the states and the different county districts for acting. They definitely needed to develop a lot of materials in a very short amount of time and develop very large teams within a short amount of time. And so, yes, we can look to our federal governments, and yes, we can judge them, but at the same time, I think us as US citizens, we have to remember the different levels of government. It's not always on the federal level. You have your state government and your local government. So definitely communicating with your local laws, as we're seeing now with the counties and how they're exercising their rights. And I think this is the very first time like many Americans are aware of the multitude of local government and the impact that they have. I think many of us are just used to looking to the federal government for advice and guidance, but that's not always the case, and it's not always needed.
Correct. Yes. I think that more people need to, wake up to the fact that we are operating at more of a local level to be able to combat this virus, and we shouldn't be necessarily pointing to the president to say you're responsible for this issue.
Of course, and there's some things that have to be taken care of on a state level. Like there's certain governors that aren't allowing schools to open. Others are saying, hey, you decide in your district, as long as you meet these benchmarks, you decide if you want to open, and that's on the public health director of that county to decide. So definitely practice and exercise your local laws, whatever side you're advocating for. Know that it's probably going to be more beneficial on a local level than on any other level right now.
Awesome. So I don't really have any more questions. I don't know if Lucas, if you have anything else.
No, that's pretty much it for now. I think that was a great update. Marcus, did you have any last minute things that you wanted to get off your chest to let American people know?
I think I will just close with all of us, we kind of want it to be over, and we're kind of overwhelmed, and we want to disengage from what's happening. We want our lives to go back to normal. We want to walk down the street, not have to wear a mask. We want to do certain things and not have to worry about our exposure. Unfortunately, we're not to that point yet. And just as citizens and as individuals, just stay steadfast, protect yourself, protect your families, and just stay safe.
Thanks, Marcus.
Thank you, Marcus. Thanks for joining us, and
You're welcome.
we'll see you guys next time.